The majority of COVID-19 deaths in this country are linked to long-term care homes. And a new study out of British Columbia may have uncovered a crucial touch point in transmission. Nadia Stewart has more on the commonly used healthcare device that's at high risk of being contaminated by the virus.
Okay, just going to tighten for a minute there.
Of all the COVID-19 touch points, blood pressure cuffs might not have been high up on the list. But a Vancouver coastal health study is drawing attention to the equipment used in long-term care homes, identifying contamination on things staff use every day.
Some of the medical equipment that moves from room to room, things like blood pressure cuffs, an electronic medical tablet, and a linen cart were actually found to be contaminated with the virus causing COVID-19.
Researchers focused on 3 care homes while they were in the midst of COVID-19 outbreaks. 89 surfaces were swabbed, 6 samples tested positive for the virus. Of the 9 blood pressure cuffs swabbed, 4 were contaminated. Researchers say some care homes have found solutions beyond even more stringent sanitation.
And that includes having dedicated equipment. So for people who are known to be infected with COVID-19, for them to have their own equipment that stays put in those rooms and doesn't present a risk to others is one thing that some of the homes have taken on as a new step.
But measures such as this come at a cost.
For things like blood pressure cuffs, you do have an option of having one-time use, but the cost of that is extraordinary.
Mike Clausen of the BC Care Providers Association says care home staff will likely focus on enhanced cleaning because so many costs have increased in the wake of the pandemic. As researchers continue to look at the surfaces identified as hotspots, Clausen wonders where residents' personal items, the family mementos inside each room, fall on the risk spectrum. He says removing them should be done with careful consideration.
They take anything that they consider non-essential to the healthcare, they move it out and they store it. And then it becomes not their space at that point. And that's what's hard. And it's hard especially with people who have dementia or cognitive issues.
Person-to-person transmission is still the primary source of outbreaks, not these cuffs. But extra precautions will no doubt be taken all the same. Nadia Stewart, Global News, Vancouver.